Today we're going to talk about tendonitis. Tendonitis is a injury that can happen pretty much anywhere throughout the body, anywhere where there's a muscle attaching to a tendon. But probably the more common areas where you've heard about it happen are probably down at the ankle with Achilles tendonitis, at the shoulder with bicipital or supraspinatus tendonitis, at the hip with gluteal tendonitis, and at the elbow with extensor tendonitis, located about right here. This is called tennis elbow. All these injuries are overuse injuries, and for the rest of the presentation we're going to stick with tennis elbow or extensor tendonitis as more of a focal point, just to kind of bring it all together so we don't get confused going to jumping around to different parts of the body. But just remember, everything I'm talking about with extensor tendonitis can still be pertinent to the rest of the tendonitis group. So like I said before, all tendinitises are a direct result of overuse of a muscle or tendon. In the case of extensor tendonitis or tennis elbow, it can be obviously from multiple things, but the thing that comes to mind first is the backhanded tennis swing. Another thing is the front hand of a golf swing, or even stuff that requires constant contraction of those extensors of the fingers, such as computer typing or mousing. Even a lot of sign language interpreters develop this kind of injury. So if you're wondering what's kind of happening down in the soft tissues or down in the muscles in the body, is the fact that when the body is required to do a lot of work, when the muscles are required to do a lot of work, that doesn't get the time to rest and recuperate as it normally would. Just how as when you're sleeping at nighttime, that's when your body recuperates itself, or your mind recuperates. That's what you need, and that's what your muscles need as well. So when it doesn't have that time to recuperate, it doesn't get the blood flow that it needs. So when you think about blood, it's more of it's a lifeline. And so what we're doing is, when you get that constant contraction, constant demand, is that you cut off that lifeline, and pretty much you're starving the tissues, making them more prone to injuries, and it causes a lot of tightness and scar tissue to build up within the tissues. So tendonitis is actually a cumulative trauma disorder, or also known as a repetitive stress injury. And this happens a lot in people with desk jobs. The treatment of tendonitis has several modifiable factors, and the most important one being rest. Like I said before, rest is when the body recuperates itself. Same thing with the muscles, and if you don't get this time, you really lead to the starvation of tissues. So it leads to an increased amount of scar tissue within the muscle, it develops tight muscles, and it leads to injuries. So in the case of the extensor tendonitis patient, let's see, they're mostly like this, hovering over the keyboard all day. So they're constantly contracting their extensors, and really basically all you need to do is every 30 minutes or so just reverse that motion, and you just hold it for 10 seconds, and that's all you really need to increase that time of rest and restoration of the tissues. And it doesn't take too much. It doesn't lead to a decrease in productivity too much in the workplace, but it will lead to a decrease in workers' compensation claims. So stretching is really important, but it's more of a prevention for extensor tendonitis, and the reason why it's only a prevention and it's not very effective in cases of actually people that have tendonitis is the fact that people still have that scar tissue, and it's hard to stretch out that scar tissue on your own. And if you can imagine what a muscle looks like when it has scar tissue, it more or less looks like a piece of rope. And just imagine that piece of rope right here. Over here you have a rubber band, and this is healthy. This is a healthy portion of muscle. It stretches a lot. This section does not stretch a lot. So imagine someone stretching out a muscle that has inflammation, it has a scar tissue. This section right here with the rope-like section, the unhealthy section, is not going to stretch. It's going to be really good for this section, so this section won't develop any adhesions or scar tissue, and that's great and all, but the person's still in pain. One thing that can help out with this is called active release technique, or ART. ART has been considered the gold standard of soft tissue care for the reason of it's so effective, it's so efficient. It's the most specific type of tissue work there is, and it can really reduce the amount of scar tissue in many different types of injuries, including tendonitis. Most people that receive active release technique for their injuries usually find a significant change in symptoms within about 3 to 4 visits or so. Most cases can be resolved within about 8 to 10 treatments, but it does vary from case to case and person to person. For more information on different conditions, please visit my other demonstrations or visit my website. For more information on active release technique or to find a provider in your area, please visit www.activerelease.com. So I'm going to show you how an active release technique provider would treat extensor tendonitis. So what happens with extensor tendonitis is there's a lot of scar tissue built up within the extensors of the forearm. It's really critical to get rid of the scar tissue before you have the patient starting to stretch. And stretching is a really good prevention tool in this type of injury. However, without active release techniques, stretching is not going to do hardly anything. Many patients will report that a lot of their pain and symptoms will decrease within about 3 to 4 treatments or so. And some people do report that they have some different kind of soreness for about 48 hours after the treatment.